अब आएगा भी।
नहीं, ये नाम उनका आ रहा है शायद, ये कंप्यूटर वो लॉगिन किए थे सुबह लगता है।
नहीं, यहाँ लॉगिन नहीं हुआ था, कॉन्फ्रेंस रूम में लॉगिन हुआ।
हाँ, लेकिन उनका नाम कैसे?
अभी तो मेल तो आपने लॉगिन किया है ना?
हाँ, मेरा
तो आपका ही आना चाहिए। आ गया ना सर?
हाँ चेंज
आ
हो
गया।
गया। ओके।
बोल के देखिए।
Yeah. Yes, friend. People are joining. Yes. Hello, Amruta. Yeah. Hello, Shantanu. Yeah.
Hello, sir. Good
Hi.
afternoon.
Yeah. Hello, I'm Shylendra. Yes,
Hi, Professor Shylendra.
yeah, nice meeting all of you. Hope you're all doing well. Right? Yes.
Am I audible?
Avijit?
Yes, am I audible?
Yeah, you are audible. Yeah.
Yeah, you can be little louder, Avijit.
Yeah, you can be louder.
Yes, sir. May we start then?
Yes, I think. Yeah.
Okay. So good afternoon, one and all present here. I am indeed happy to welcome everyone to the first panel discussion session of DOCMAD 2020, which has been named COVID-Conundrum. The COVID-19 pandemic needs no introduction. Though it is a threat to the human civilization at large, challenging lives of many globally, and with almost all activities coming to a standstill, I strongly believe that it has also come with some lessons too. Speaking on Indian context, we have witnessed incidents of reverse migration, labor market distortion, distortion in education, and any activities that we can ever think of. So it has also got various impacts on the society as a whole, and the impacts goes on so on and so forth. The list is never ending right now. So without further ado, I, Avijit, would like to introduce our eminent panelist, Dr. H.S. Shylendra, who will be the chair of the panel, Dr. Kingshuk Sarkar, Dr. Santanu Pramanik, and Dr. Sudeep Basu. Dr. H.S. Shylendra is a professor in social science area at the Institute of Rural Management Anand, IRMA. He has been a member of the Center for Sustainable Livelihood and Center for Rural Urban Dynamics at IRMA. He has over 27 years of experience that combines teaching, training, research, and academic administration. His main areas of interest are rural development, rural livelihood, microfinance, development theories, governance, and cooperatives. Currently, he is pursuing two studies. First, with the rural issues in rural transformation and dynamics of changing livelihoods in rural Gujarat in the post reforms era, and second, impacts of COVID-19 on rural livelihoods. So Dr. Shylendra has also two books in his name, 3 monographs, and several research papers to his credit. He has been a part of few expert committees and working groups tasked with examining policy issues in the areas covering cooperatives, rural credit, local governance, and insolvency. Sir, I welcome you to the panel discussion that we are going to have a little while later. Next, I'd be happy to welcome Dr. Kingshuk Sarkar. He is an independent researcher and also work as a labor administrator. Uh, he holds the position of Joint Labor Commissioner with the government of West Bengal. He earlier served as a faculty of V.V. Giri National Labor Institute, Noida, and NRD, Hyderabad. Dr. Santanu Pramanik, so I welcome you to the session that we are going to have. So Dr. Santanu Pramanik is a senior fellow at NCAER and deputy director of NCAER National Data Innovation Center. Dr. Pramanik is a survey statistician by training with a strong interest in public health. Before joining NCAER, he worked as a research scientist at the Public Health Foundation of India. His research interests lie in applying statistical techniques and survey methods in public health and other areas of social development, including designing cross-sectional surveys, conducting randomized evaluation studies, small areas estimation, and infectious disease modeling, and analyzing data from panel and repeated cross-sectional surveys. At NCAER, National Data Innovation Center, he has led 3 rounds of telephonic surveys in the Delhi NCR in order to understand and quantify the early impacts of the coronavirus pandemic and the pandemic's induced lockdown. Next, I would like to introduce Dr. Sudeep Basu. Sir, I welcome you to the panel discussion. Introducing Dr. Sudeep Basu, he is a sociologist and a social anthropologist by training and has received his graduate in Masters and MPhil in Sociology from the Delhi School of Economics. His doctoral dissertation was obtained from Jadavpur University, Kolkata. He was the C.R. Parekh Postdoctoral Fellow 2012-13 at the London School of Economics, Asia Research Center. Presently, he is teaching at the Center for Studies in Social Management, that is the School of Sciences, Central University of Gujarat. His research interests are in the areas of refugee and diaspora studies, migration and development, marginalities and exclusion, law and society, critical theory, philosophical anthropology, and the sociology of knowledge. He has also authored 2 books. First, being In Diasporic Lands, Tibetan Refugees and the Transformation Since the Exodus, and the second is the Marginalities in India, Themes and Perspectives. He has also published papers in several referred or peered reviews journal such as Economic and Political Weekly, Sociological Bulletin, Social Scientist, International Journal of Migration and Border Studies, Indian Journal of Human Development, etc. So, sir, I welcome all of you, and I'm looking forward to having an enriching and a very good, insightful panel from all of you. Thank you, sir, and I welcome once again to all of you. Sir, Professor Shylendra, sir, I hand it over to you. You can take it over.
Okay. Thank you, Avijit. It's a good afternoon, all of you.
You're welcome, sir.
All of you are doing well, especially those of you who have joined from outside, because I'm happy to be participating in this panel discussion. Because at the outset, I would like to thank Dr. Hippu for giving me this opportunity. It is an excellent kind of a forum that they're trying to create at IRMA. It's a very relevant one, particularly in terms of our research. So I also congratulate them for the effort that they have put in. Yeah, of course, now here in this panel, I am supposed to be acting both as a chairperson and also as a member, right? So I'm supposed to wear 2 hats at a time. Of course, let me first play the role of the chairman, wear the hat of the chairman first. And then, of course, I will take up my role as a speaker or as a panelist, right? Okay, because we are totally having about 90 minutes time. We are supposed to end at 5:30. And then therefore we need to overall, in that sense, conserve time for all of us, including for the participants. So it is basically meant for them. So we need to also give a good amount of time for that purpose. Yeah, so and then therefore as a chairperson, I would like to play that role little diligently. Basically that it serves the purpose for which it has been arranged. That of helping all of us also, of course, because all of us will become now, will have more clarity on this problem. And at the same time, also all these young researchers who have joined, right? Possibly some of them also may be looking at COVID as a potential area of research, right? So it's meant for their sort of training and orientation. So therefore, we should give them enough opportunity. Right, so without therefore wasting much of time on these formalities, so let me, as a chairman, briefly, of course, Vijit was saying few things about COVID, so we're all familiar with some of those aspects, right? Yeah, so let me say a few aspects as to why possibly the panel, the organizers are calling this panel discussion as COVID-Conundrum, right? Of course, COVID phenomenon is being called by various names. Some are calling it as a shock, some are calling it as a crisis, some are calling it as a chaos, chaos of an unprecedented order. Of course, world has faced, this is not the first time also world has faced a pandemic like this, because it is said that the last millennium itself, as per the historians, so more than 15 such major pandemics have hit the world, including, of course, the 1918 influenza flu, which is expected to have killed about 21 million globally and about at least 12 to 13 million in India itself, right? So of course, what has recovered from all those pandemics? So that gives some hope that yes, definitely we will possibly recover from this pandemic also, right? But there is, of course, when we now look at based on, of course, our understanding of the past. Yeah, am I audible? Abhijit, I am audible?
Yes, sir, you're audible.
Okay. Yeah, so yes, so we have overcome, and then of course going by sort of an historical understanding that is there, right? And the kind of understanding that we are developing with regard to COVID. COVID apparently is unique in many ways, though it's also a pandemic and possibly has caused considerable damage. It's unique at least in the sense that yeah, it's a novel coronavirus epidemiologically, but it has come at a time when in terms of economic development or even in terms of advancement in the medical science. So we are at a much higher level than what we were when we faced some of the earlier pandemics, right? So therefore, in some sense, we are in some disadvantageous position as compared to people who face such pandemics earlier, right? And then, but of course, still the solution is elusive, right? Be it in terms of the economic problems that we have faced, or even in terms of finding a vaccine, right? So that is still eluding the humankind. And then the second, of course, kind of uniqueness, as I see it, is that so many of the problems of this pandemic are also kind of man-made kind of problems, right? So which has, in some sense, sort of made the problem more acute, right? Whatever the damage that COVID itself has done. Yeah, so though the final word is yet to be said, because we are still in the middle of the pandemic, apparently, yeah, going by the 1918 pandemic also, which ran for nearly 2 years, right? Yeah, I would like to, of course, I agree, of course, with the term conundrum, it's a major problem. It's not that easy to resolve that. But I would like to call it as, based on my understanding, as a phenomenon which is of a multidimensional crisis, a phenomenon ridden with multidimensional crisis. Of course, which has such a phenomenon of multidimensional nature has hit the world, which is already in some kind of a crisis, right? Of course, as social scientists, right? As our own understanding of how the nations are progressing, right? Economies are progressing. So the recent phase also has been one of a major economic crisis. So this COVID has come with its multidimensional impact at this kind of a stage. Yeah, so therefore, I would call it as a multidimensional crisis. Though various kinds of aspects of COVID can be identified, I would identify 3 major dimensions. One, of course, its cause or the origin, right? Of course, it is a virus-based disease. That much of understanding is very clearly there. It has emerged from the zoonotic sources, but people attribute that this has happened because of human intrusion, right, into the nature. So in a sense, human beings are responsible. Human beings are the kind of economic system which is driven by profit and market. That possibly has induced this kind of zoonotic interaction, right, causing this virus. Right. Of course, this many scholars have tried to establish this well, not only with regard to this coronavirus, but also even with regard to earlier corona viruses, right, which have hit the global nations. Right. So it is therefore, in terms of the cause, right, though it is zoonotic source, but that human intervention into nature causing such a kind of a problem is also an issue that we need to look at, because if in case even in future we have to avoid, definitely we should be working towards preventing or avoiding such kind of pandemics. So, but this relationship, right, so the human intrusion into nature and the emergence of such viruses to be taken note of, right? So unless we address at some level, of course, maybe scientists, epidemiologists, and also, of course, policymakers, yeah, then we may be possibly ignoring the real nature of it. Then the second dimension of this is, which is the major one, is the health crisis, right? So manifested as a pandemic and as a health crisis of a varied nature, right? So one is, of course, as a disease, how do we tackle it, right? Of course, we do not have medicine yet, right? So therefore, there are other various ways, indirect ways, preventive measures. So lockdown and such measures are being advocated and adopted, right? Social distancing, or even some arguing that possibly we should aim towards creating herd immunity, right? So to attempts like right, actually tackling the problem, right? Healthcare itself, right? So there are, of course, again, there are challenges and problems here, even there. Testing is an issue, right? Which has become a major issue in terms of its rate and the speed, right? The treatment, right? Given that there is absence of a proper medicine, right? So what kind of treatment is the best one, right? And also the whole issue of hospital treatment versus the home quarantine, right? And in terms of governance, a major issue that has cropped up is the controversy over public versus private kind of healthcare, right? And some of the nations were forced even to nationalize their own health system because private system was not responding. Yeah, and that has happened also in the Indian context. Not that the public system has responded well. And then all said and done, there is also the issue of vaccine. Everyone possibly is waiting for vaccines, but science is yet to deliver, right? So though we are in an advanced stage as compared to, as I said, past pandemic, but science is yet to give us the solution. And therefore, we are all hoping on it. And unfortunately, my own observation, my own understanding is that so there is lack of also collective effort, particularly given the dominance of markets. Certain private sector agencies also have their own interests. So that has diluted the kind of a global collective efforts that would have possibly hastened the discovery of vaccine and other medicine. So that also has aggravated the problem. Yeah, so those are some of the issues with regard to health crisis. And then the third dimension is, of course, the socio-economic crisis, right? The socio-economic dimension of this pandemic. Right, of course, this we can see in many ways. One, of course, is the economic crisis that has unfolded, right? Due to lockdown and all the suppression of economic activities. So we are into kind of a major recession, all nations. And India, of course, recorded the last quarter minus 24% of GDP decline. So which has severely affected the livelihoods and employment, right? And therefore the prediction is that in the coming years, so poverty situations are going to worsen, right? So that is one major kind of a socioeconomic crisis. And then socially itself, right? Of course, it has affected various dimensions. It has not even spared the gods and the temples, right? Of course, social distancing, which has been used as a mechanism, right? In terms of preventing the spread, is also creating real kind of social distances, right? Discrimination has come in as a result. So, of course, one way we see is that still many of the people who struggle for their livelihoods because of this social distancing are not able to resume their work, like many domestic workers or such workers, right? Social distancing has taken economic kind of a dimension. Then there are also a variety of stigmas, anxieties, increased suicides as is being reported, right? And also the area of education. We are all in this field of education. We know as to, though online education has come, but that is also not helping in a majorly way, because there is a big divide, a rural-urban divide, and also divide between the poor and the rich. And that is further again, right, creating inequalities socially, which are going to have a major impact in the coming days, right? Yeah, so therefore, when we say it is a conundrum, of course, what I'm calling it as a multi-dimensional crisis. So therefore, it covers some of these areas. Of course, this is not exhaustive. Yeah, but definitely we need to work towards a solution, right? Solutions are being thought of in various ways. Of course, it is an economic, of course, at the primary level and health crisis. So therefore, we definitely need to expedite, right, vaccine and other kinds of cure for the disease, right? And that would require a collective effort, in my view, right? And then second is economically as to how do we revive the economy. Some are saying that possibly this is the result of the past crisis and it has got aggravated, and we may have to think radically. We may have to possibly change the way we are organizing ourselves, right? Particularly the way capitalist system is organized, and the way it is also led to problems like corona, right? So therefore people are suggesting radical ways even economically. And some of course are saying that possibly technology will give us a solution, and even reforms possibly will give us solutions. People are, of course, governments are resorting to reforms. So therefore multiple ways people are exploring. We need to, of course, there is a lot of again, confusion, and there are a lot of arguments, debate. We know as to even with regard to agriculture sector recently, how the farmers have protested against reforms, right? So though in the name of pandemic or crisis, government has tried to push in those reforms. And so therefore, it's a major kind of a crisis. Solutions are not therefore that easy. It's multi-dimensional. Therefore, we need to understand this crisis well. Therefore, possibly this panel discussion titled as Corona Pandemic, so will help us understand better. It will throw insights on many of the issues on which still we don't have answers. So first of all, therefore, we need to become fully clear of what exactly is the problem and how do we approach. And possibly we could be learning from some of the past pandemics, including the 1918 pandemic about which I was reading. Yeah, I stop here. So now with these few issues that I think as possibly areas of discussion under this, of course, the panelists are free to, they have already indicated their own topics. But I thought that at a general level, a highlight. So with these remarks, now I call upon our first speaker, Dr. Kingshuk Sarkar, right? So who is going to speak on the topic of impact on labor market, right? Of course, as we all know, livelihood crisis is a major area, and labor reforms are also being attempted. So how therefore reforms and the economic crisis are going to affect labor and livelihoods is an area we all need to focus upon. Yeah, so that's a relevant area. So therefore I call upon Dr. Kingshuk Sarkar to make his presentation, right? So maybe you take about 12 to 15 minutes maximum, so that all of us get that much of time, and there is some time for discussions. Let us keep the discussion at the end. So all the participants, if they have any questions, please type out your questions in the chat box, so we can also later on take up if there are any problems also in terms of you are reaching out to the panel, right? Okay. Yeah, Dr. Kingshuk Sarkar.
Hello, am I audible?
Yeah, yes, Dr. Kingshuk.
Thank you very much. On the outset, I thank IRMA for giving me this opportunity to share thoughts on the impact of COVID-19 on the labor market, particularly Dr. Hipu for kind of contacting me for this webinar. And I'm also thankful to the chair, Professor Shylendra, for giving such a nice introduction to the topic. I will try to confine within the time limit. So I start my I will talk. I am not present as such. Onset of COVID-19 pandemic and subsequent nationwide lockdown had severe adverse impact on the labor market. As economic activities came to a halt, large number of workers lost livelihood. Even otherwise, the unemployment rate was highest even before, just prior to the lockdown. In the February, some estimates came out in the public domain that unemployment rate was highest in the last 45 years. Things became very precarious subsequent to the lockdown. Things became much more worse after the lockdown. Majority of workers are in the informal sector. In India, 93% of the labor force are in informal sector, where there is no job security, no social security. And terms of employment and conditions of service are casual and temporary. All the arrangement collapsed during the few days of lockdown because all economic activities were stopped except some activities in the agricultural sector. Within also the informal sector, around 52% of the people who are engaged in the informal sector are self-employed. And almost all the self-employed people lost their job. And concept thing is that even if suppose our unemployment rate may not be that high, but still what happens is that in the last 3 decades, people do get work, or in rural areas, or in suppose where there are economic distress, it is a luxury to remain unemployed. So people do something or other to get to earn some money. So they are severely unemployed, underemployed, and on the same time, whatever they earn is much below the minimum wages. So what happens for wage employment? We have a standard that you may call minimum wage, but self-employment, there is no standard. Suppose I give example, suppose a cycle repairing shop. Sometimes the cycle repairing shop is a kind of an endeavor where the person who is running it may not even earn may not even break even. Suppose the cost he is incurring to run that cycle repairing shop and the revenue that he is earning, or he or she is earning, may not be enough to even cover the revenue, cover the cost. So people actually work, but at the same time, they remain poor. The concept of working poor, that you may get some work or otherwise, but you still remain poor. So this factor came in, this factor was manifested just after was announced, because we could see the kind of crisis in around us. Suppose, and informal workers don't have adequate savings to fall back upon, and they actually could not survive beyond a couple of weeks. Actually, the lockdown was announced lockdown became effective from 25th March, and from second week of April, we could see the crisis in around us. In all big cities, the informal sector workers were running back, were returning back to the native places. There was no transport. Still, they walked long miles, and these factors also prove that our labor market is such that the laborers, when they were getting some work before the pandemic, but when the lockdown was announced, they could not work because the economic activity stopped, and they even could not survive beyond 2 weeks. So they don't have the kind of earning they have. They don't have enough money to sustain themselves beyond 2 weeks. So why? And this huge informal sector, what happens that our GDP growth rate is quite decent. We were if till 2016-17 we're having a growth rate of about 7 to 8%, but employment growth rate was very low. The employment, particularly the employment elasticity of manufacturing sector, was very low, and there has been an occupational mismatch that happened with the sectoral distribution of national income. Means primary sector's contribution in national income fell to 14%, but at the same time, the people engaged in the primary sector did not decline to that level. So that was the problem, and people came out and they were in the urban sector searching for some informal service sector jobs because manufacturing sector could not absorb those people. This is the crux. And I'm discussing this because this is very much related to the crisis that we witnessed after the lockdown, COVID-19 induced lockdown. So what we there was huge job loss in the aftermath of lockdown. There was a layoff and retrenchment, wage cut, and salary cut in spite of the government order. The government ordered that under NDMA, National Disaster Management Act 2005, that all the employers are requested by both by the central government and state government not to cut the salaries. But they actually, there was no pay, no work kind of thing that prevailed. And also there was this issue of retrenchment and layoff. Even and to places they could survive because allocation to the MG was increased to some extent. So MG Nareka at least helped to maintain subsistence level at the rural areas where there was returning migrants. And after, suppose when the economic activity again started in mid-June, the few migrants again went back to their native place, to the urban places, at the places of work. Then sometimes even employers help them to come back to their workplace. Still, labor market is suffering from lack of livelihood opportunities, and as economy is yet to resume the activities fully. So there are a huge amount of crises in the rural areas even now, because the economic activities are still not returned to the level, the pre-lockdown level. And this shows that there are certain things that is very important in this respect, is that what we have seen is that the lockdown and the pandemic and the lockdown made us made a few things very clear, like the precariousness, the precarity of our labor market, that our labor market could not sustain even beyond 2 weeks. So the kind of employment, quality of employment, the kind of earnings, the labor share out of the total value that is being generated, this shows the kind of precariousness. Also, these informal sector workers, they work among us, but the middle class and the upper middle class did not even notice them. But this lockdown, the one thing is that this lockdown made us to notice them. They were all over the in social media, public forums. So we could see the crisis they're going through. And most people, problem is that most people, when actually the labor market is such that if the life continues, if economic activities continues, they somehow could survive. Beyond that, if economic activities come to a halt, their livelihood also comes to a halt. So there is nothing to fall back upon, and our system has nothing, no social security of what's its name to support people in case the economic activity stops. So lockdown accentuated the exploitative characteristics of the prevailing labor market. Many of the labor laws were made non-operational. Even during that period, the states like Uttar Pradesh and Madhya Pradesh, they have suspended labor laws. So whatever little kind of protection that workers were supposed to get, that was also withdrawn. There was also increasing child and bonded labor. Even government estimates show that child and bonded labor increased. Ease of doing business was the main criteria, was the main focus. And that got the topmost priority even during the lockdown period. Also, suppose few days back, the question is that, is it a surprise that government doesn't know the number of migrants who died during the lockdown? The central government told Parliament on September 14, 2020 that they had no data on number of interstate migrant workers who died during lockdown. The government confessed that it has not maintained any data on the number of migrant workers who died while trying to return to their homes after the nationwide lockdown was announced in the evening of March 24, 2020, following outbreak of COVID-19 pandemic. Few Lok Sabha MPs asked the government if it is aware that a number of migrants lost their life during the return to their hometowns. Besides this, the MPs also sought to know if the government had provided any compensation, economic assistance to the victim's family. To this, the Union Ministry for Labour and Employment in a written reply said no such data is maintained, and that the answer to the question on compensation doesn't arise since there is no data. When asked if it has done any assessment of job losses among migrant workers due to COVID-19 crisis, the government again replied, no such data is maintained. Apparently, the answer might seem harsh and insensitive, but a deeper analysis would reveal that the government indeed has no legal mechanism to keep track of such development, notwithstanding the pandemic that the country is passing through. Even during the normal times, the government is oblivious of happening in the labor market in the informal sector. The architecture of interstate migration has changed significantly over the last 3 decades. India enacted Interstate Migrant Workmen's Act in 1979. The context and premise on which ISMW Act was formulated underwent fundamental changes in later decades. In the present scheme of things, migration are not mentored as such by the contractors in home and host states. Migrations are set free and apparently happen because quest towards finding employment elsewhere. The state doesn't have a mechanism to monitor or regulate migration as such. Present-day migration is a voluntary phenomenon in a deregulated labor market. The entire architecture of migration as conceptualized in ISMW Act 1979 has undergone significant changes over the years, and in the process, Section 12, which talks about registration of migrant workers both in the home state and the host state, doesn't arise because now the workers, they migrate on their own. They don't wait for the contractors to facilitate migrations. So under such, this kind of paradigm shift was not taken care of in the last 3 decades. Migration network operate through kith and kin and through close acquaintances. Words of mouth have an important role. Barring few established construction companies, contractors in home states do not have any significant role to play. Contractors in host states do engage workers as contract labor, but their migrant status remain implicit. Quite a significant number of interstate migrant workers are self-employed and engaged in petty economic activities in cities. Employer-employee relations do not exist, and ISMW Act 1979 is not applicable in such instances. So under such circumstances, in the prevailing pandemic situation, from the techno-legal perspective, it is not surprising that government did not come up with the data regarding death of migrant workers. Learning from the things that happened during the pandemic, so there, but I will not say that everything is pessimistic. A few things got incorporated because in the process, in February, there was this new labor codes was supposed to be tabled, but could not be tabled. But ultimately, in the brief monsoon session that happened in September, 3 labor codes, the wage code was published, wage code was placed in last August and got passed in both houses of the parliament. And then later on, 3 more codes were presented in the parliament in September 23. And all the 3 codes, codes on social security, codes on occupation and health, safety and working conditions, and codes on industrial relations. And all these 3 codes have very significant impact on the labor market. And they have been placed and passed also. Now rules are being formulated. But
Kingshuk, please,
experiences of... sorry?
Can you
I take 2 minutes more. I take 2 minutes more. So, so what happens? Learning from the things that happened during the pandemic-induced lockdown and its aftermath, the Code on Occupational Safety, Health and Working Condition 2020 has ultimately provided certain provisions which is relevant in the post-COVID period. The earlier draft did not have these provisions. The February draft did not have these provisions, but when the draft was again presented in September, the migration architecture, as we witnessed during the learning from the crisis that happened after the lockdown, the new definition actually incorporated the possibility that a migration can happen on its own, and a self-migrated person can be also registered. His or her documentation is also possible. So under the new code, a migrated worker from one state to another state can document his or her status or kind of data on a portal. So self registration is possible, which was not possible earlier. Now it is possible. But at the same time, suppose regarding the social security, the code on social security did not universalize social security. If again the COVID kind of things come up, like even we are not like fully get rid of COVID, even now it's still continuing. Suppose such things happen again. So again, the similar kind of things will going to happen, because the social security is still an elusive concept for most of the informal sector workers. The new code did not incorporate it. Again, it again depends on the threshold limits on of suppose only those establishments which is employing more than 20 workers, more than 10 workers, their social security is taken care of. But the huge informal sector, 93% of the workforce, they don't have any kind of social security even in the new code. So that is another negative point. So certain points have been taken care of, certain points, certain very important were not taken care of. But to end, I will conclude that our labor market is very, very delicate and precariously placed, and the COVID-19 and the subsequent lockdown actually made us witness
Okay. Yeah. Yes. Yeah. We seem to have last contact with
COVID-19 and subsequent lockdown has manifested the crisis. Thank you.
Okay, Dr. Sarkar, thanks for your sharing. Yeah, Dr. Sarkar highlighted the precariousness of the workforce, particularly under the unorganized sector, and how COVID has further aggravated their problems. And at the same time, he brought out the issues as to how our laws and policies are highly inadequate, even with the current amendments, highly inadequate to address the needs of such informal sector workers. Yeah, so these are some relevant points in terms of understanding the livelihood and labor related crisis. Yeah, now I call upon our second speaker, Dr. Santanu Pramanik. Dr. Santanu?
Yeah,
Yes.
hi, Professor.
Dr. Santanu will share findings of a survey done in Delhi.
Yeah, let me try to share my screen if I have the rights.
Okay. Yeah.
Yes, you can see my screen, right?
Yeah, it's visible.
Okay, thank you. Okay, so good afternoon all. I'm honored to be part of this doctoral colloquium at IRMA, and would like to thank Dr. Hipu for reaching out to me to be part of this panel. So before I start, just briefly about my institution and the center I work for. So basically the objective of our work, our center is slightly different than most other organizations, where usually there is a substantive focus, but here what the type of work we do, our focus is essentially the improving to conduct methodological experiments with the overarching objective of improving data quality and strengthening the data ecosystem in India. So I mean, we all sort of understand the importance of data and the need for the use of data in the context of informing and measuring policy decisions. So in that context, so the quality of data is actually even more important. So we were conducting different methodological experiments through one of our flagship study called Delhi Metropolitan Area Study. And when the final phase of data collection was ongoing, final phase of data collection to evaluate different experiments around use of innovative modes of data collection, technology-based modes of data collection, use of high-frequency surveys, different innovations around questionnaire designing. So in March, we were at the final phase of data collection for that study, and then this pandemic happened, and we had to stop our data collection mid-March. And then since we had the resources at that time, we had 40 interviewers sort of working with us for that, the original study that we planned. We thought that we can use these resources to collect data at a time when there is a need for a scientifically collected data, but it is impossible to do to collect the data through face-to-face data collection method. So then we use this telephone mode of data collection to understand the early impact of this pandemic, and see, as Professor Shylendra mentioned, that what are the different dimensions it may have been have impacted the population. So briefly, in summary, the objectives of DCBTS, the Delhi NCR Coronavirus Telephone Survey, was to estimate the level and changes over time in areas of people's knowledge of the virus, people's attitude, perception towards the risk of a coronavirus infection, and practice behavior of preventive and control measures, especially in the context of social distancing. And also, and more importantly, rather, the impact of the pandemic on people's livelihoods, income, access to essential items, social life, and the hardship they faced during this time, and also the different coping mechanisms that were available to them. And another secondary objective was to explore differences in these indicators across various socioeconomic and demographic groups, as well as different occupational groups. So this is the timeline this is the timeline that we followed for 3 rounds of this survey, DCBTS survey. The round 1 happened about after 10 days after the initial lockdown was announced. That's between April 3rd and 6th. And then the second round happened after the extension of the lockdown happened in April 14th for 2 more weeks. And then we waited for a few weeks, and then we thought that once the lockdown is relaxed and the unlocking process starts, we wanted to capture the challenges people are facing and how the economy is recovering. So then the third round, we have conducted the third round in mid-June. So briefly on methodology, because I thought this is a sort of colloquium for doctoral students. So as opposed to focusing just on the findings, I thought it would be good to spend some time on the methodology.
Yeah, that's good. That's good.
Okay. Yeah. So as you know, I mean, when we design a survey, we first need to define the target population. So here our target population was Delhi NCR, and which not only includes the metropolitan areas of Delhi, it also includes the urban and rural parts of Haryana, Rajasthan, and UP. I mean, as well as districts like Alwar, Bharatpur, those are also part of Delhi NCR as per the NCR Planning Board. So in summary, basically, the population that we consider is actually quite heterogeneous and also includes quite remote areas as well, although it may not be apparent from the name of it. So in the first round, DCBTS 1, we have a panel sample. Essentially, the sample that we were following at that time for our original DMAS study, we used that sample for the first round of DCBTS, and it has so basically, so those sample was actually surveyed 3-4 times in the past. Okay, so it has its pros and cons. So the advantage was that since we have an existing relationship with the households, with the respondents, and we have their updated phone numbers as we are visiting them every quarter, so we are able to achieve a higher response rate in DCBTS 1. On the other hand, the disadvantage is that since this is a panel, you know that every round of the panel, some households tend to drop out from the survey. So with time, your sample can become more and more selective in nature, because every round, and we know that the households which dropped out of a survey, it doesn't happen at random usually. There's a certain type of households who usually dropped out from survey. So we did some analysis and validation of sample representativeness and selectivity after the initial findings were disseminated. So in round 2, what we didn't follow the same households that we followed in DCBTS 1. We selected a new random sample of households from the original clusters. Okay, so the clusters remain the same. By cluster, I mean villages in rural area and urban blocks in urban areas. Clusters remain the same, but we selected a new random sample of households after excluding the DCBTS 1 sample. Okay, and in DCBTS 3, what we did, we included both the DCBTS 1 and 2, particularly mainly because we wanted to do some desegregated level analysis by occupation group, etc. And we realized that the individual DCBTS 1 and DCBTS 2 sample was not enough. So we combined these two samples and followed all of them in round 3. Okay, so, and the median interview length was less than 15 minutes, which is kind of ideal for a telephone survey. It's usually recommended that it shouldn't go beyond 15-20 minutes. Then interviewer can break off at any moment. Okay, so now just the point I mentioned earlier, in DCBTS 1, we are able to achieve a response rate of 77%, which is quite high, I would say, in the context of a telephone survey. And particularly if you compare with developed country telephone survey response rates, I mean, it's much higher than that has been documented in the literature before. But you see in DCBTS 2, which was the null panel, where we didn't follow the same households, we experienced a much lower response rate, significantly lower response rate compared to DCBTS 1, mainly because the phone numbers that we had for those households, those were collected long back, like 15, 16 months back during the house listing exercise. So, and as you know that in India, people often change their phone numbers quite frequently because the different service providers provide different offers, etc. So you see the non-contact rate, the row that is highlighted as non-contact rate is much higher in DCBTS 2, is like 23% compared to 12% in DCBTS 1. So most of these non-responses can be attributed to the non-contact. We couldn't contact the household because of the phone numbers were not updated. Okay, so now coming back to some of the findings. So the first finding that I would like to highlight, the reduction in household income. Okay, so what we have noticed, and what my earlier speaker also mentioned, and you have read reports on these in various newspapers as well. What we found that 85% of households reported some level of reduction in income. So this is based on our third round of survey data. So 85% of the households reported some level of reduction in income in May. So the survey was conducted in June. We asked about the previous month, that's in May. And in terms of any type of reduction in income, we didn't see any significant urban-rural difference. But when we ask about the severity of income reduction, so this is the question we asked at the bottom of the slide. You'd see the question. Compared to before the lockdown, did your monthly household income fall in the month of May? Options were very much, somewhat, and not at all. So the households reported very much. That was significantly higher in urban areas compared to rural areas. So this is an area I'd like to highlight. So what happened, because during these COVID times, the chance of infection, as we know, is much higher in urban areas because of the population density, etc. And also the impact of COVID is actually much higher in urban areas compared to rural areas. And this is one instance I'd like to mention, that significantly higher percentage of urban households reported that their income and wages had suffered very much, okay, compared to not at all and at some level of reduction. And this is very similar to what we have noticed in earlier rounds. And also some other surveys happened in other parts of the country during the same time. It's very similar estimates of income reduction. Okay, so in the next slide, the same income reduction, but by occupational groups. So we have asked about the primary source of income for the household and categorize the household into 4 or 5 categories, which are the casual wage work household, business household, salaried work household, farmers, farming households, and there's very few households in the other category having rent, pension, remittances as their primary source of income. What we have seen, if you look at the bar diagram, that the casual wage work, which is the leftmost bar, casual wage work and the business households, they have reported the highest percentage of such households reported that their income has been reduced significantly. That's been very much a reduction they have noticed. The casual wage work and the business households, which is much higher compared to the total category, overall category, as well as the salaried category and the farming households. And the farmers, what we have noticed throughout all the 3 rounds, farmers are somewhat protected during the lockdown because of some of the relaxations were allowed for the farmers. And even during the 3rd round, we noticed that farmers are still the least affected along with the other category, which is a very small category. And another interesting finding that we noticed that salaried workers and farm households, which were relatively less affected because of the pandemic, about 20% of them, for 20% of salaried workers, 20% of farm households, if you look at the not at all category, they reported that their income has not been affected at all during the lockdown. And this is in the bottom table, you see the distribution of the sample across different categories. And we have reasonable sample size in all the occupational groups except for the other. Yeah. So now another interesting findings that I'd like to highlight. People thought of this pandemic or this coronavirus as very dangerous. So we have a question like, they think this is a very dangerous thing. But when we ask them about their own chance of getting infected, we found very surprising results. Actually, most of the households, they don't think that this is the results I'm reporting from June. And also across 3 rounds of the survey in the right panel. So things may change now because more and more people are getting affected. But at that time, what we found that even though people thought that this virus is very dangerous, etc., but they don't think that they can get infected. So more than 70% people actually reported that they don't have any chance of getting infected. And there's a significant rural-urban difference. If you see the left bar and compare the 2 bars, so green is the rural and the steel gray is the urban. There's a significant difference between rural and urban, which makes sense. But that the amount of the percentage of people reporting no chance actually was quite surprising to us. And on the right side, if we compare 3 rounds, it's more or less remains steady over rounds. And yeah, there's not much difference. Only in the 3rd round, we have noticed some more percentage of people reporting they have high chance of getting infected. So this is the question at the end, the bottom of the slide that we asked. So now when we look at the relief measures and whether it actually reached to the people and was it adequate. So what we found that alongside the loss in income or wages, the safety net measures announced in the wake of lockdown also kicked in during this time, and 47% of households in the Delhi NCAER region received extra ration. So we asked about extra rations, not the ration they were originally receiving in the normal time. So, and they mentioned that 47% household mentioned they received extra ration in the last 30 days prior to the survey. And again, another point I'd like to mention, we noticed significant rural-urban difference, whereas the impact was much more in urban, but more people in our rural households actually received ration. So that's because the way our social security programs and welfare measures were designed, it's more rural focused, which is good, of course, in normal times. But we needed to think a bit more in how to reach out to the urban poor. We found that was kind of missing. And 29% received additional cash transfers from the government, but the amount was very modest. I mean, it's actually very low, I would say. In rural households, it was median amount received was 1,000, and in urban households, it was 500. So there's some concern of urban exclusion. I mean, as I said, although the coronavirus impact is likely to be greater in urban areas. So this is essentially the same.
Santanu, can you try and conclude quickly?
Yeah, a couple of minutes. So this is the graphical representation of receipt of relief in the last 30 days. Basically, the urban-rural divide is quite obvious from this graph. Now the status of casual workers, so which the group which is most affected because of the lockdown, what we have seen that they have received relief measures. 68% of casual workers received additional ration as compared to 47% when we look at overall households, it's 47%. So it's much higher for casual workers, and also 41% received additional cash, which is also higher than the overall percentage. But the important point is 30% of casual wage workers did not receive additional rations in spite of their need for it. So these could be the people who they were not part of any existing program. So probably that's how they were missed out. So few methodological issues I'd like to skip probably here, just to briefly because telephone survey was not very common in the pre-COVID era. So it is important that we try to understand the representativeness and selectivity it may introduce in the sample. So we did some analysis on that as well. And the one important question that I get to hear from everyone that we have phone numbers for our household. That's why we are able to conduct phone surveys. But when we don't have phone numbers collected beforehand, so how one can do phone surveys in that context? So Rice Institute, they actually conducted a survey called Social Attitude Research India SARI survey, and where they use this random digit dialing method. I'm not going into the detail of the method, but just wanted to mention it so that if there's a need for any student or any other researchers to conduct a surveys, they can look into this methodology where in the absence of pre-collected phone numbers, how the phone numbers can be randomly generated and called upon to conduct a survey without introducing bias. Yeah, I think that's all.
Okay, that's good. Yeah. Yes, thank you, Dr. Santanu, for sharing the findings of this telephonic survey from Delhi. Right, of course, it in a way confirms some of the kind of fears that everyone has expressed, that the lockdown has severely affected the livelihoods of the people, and the extent of income loss, job loss that they have reported, and the kind of impact relief measures have made. So overall says the kind of impact that has happened, right? Of course, it would be also interesting to see whether any revival has happened, right? In case you're going to do another round of survey, right? So that will give us an idea that whether this was lockdown specific or it has continued, whether the crisis has continued like that. Okay, so maybe also some of the scholars can get in touch with you, particularly about methodology and other things. But for our panel discussion, so the issues that you have brought out were interesting and relevant. Now, I now call upon our next speaker, Dr. Sudeep Basu. So, who is going to make presentation on the topic apprehending capital coronavirus and its social effects, right? Of course, yeah, that would be interesting. Of course, we have possibly got some views from the economists, maybe from social dimensions of coronavirus or COVID impact also would be useful to get a multi-dimensional perspective. Yeah, so Dr. Basu.
Yeah.
Okay.
Can I be
Yeah.
heard now?
Yeah. Sure. Sure. You're.
Right. I'm very grateful to Dr. Hippu for inviting me, and of course, Professor Shylendra has given a broad overview of what is expected. And one dimension that, of course, I will be focusing on here is the social one. But first, let me just mention that what we can observe as an immediate response to the pandemic was the arresting effect that lockdowns and quarantines had on the entire population. But this pandemic itself actually signaled a break from the past, a new way of trying to understand the social world around us, as well as the new techniques of power, which, as we know, increasingly, it is stressing on self-regulation, self-preservation as a way to cope with the pandemic. There is also a hope and an anticipation that there will be an increasing responsibility of the state and the society as arising out of the ashes of the pandemic. But of course, the pandemic is still to leave us. Now, the potential of these new formations, actually, we see is palpable right away in the changing significance of public health, doctors, nurses, ASHA workers, and sanitation workers who were till now invisibilized. And whether these will have an effect on whether these will have a political effect is of course not the domain here. But while, and I would like to stress a bit here, that coupled with this, there is also, we have to recognize, a resurgence of the politics of hatred. So while the identifiable structures and actors are getting the attention, the forces and the process that can match the invisibility and the universality of the virus is capitalism itself. And that's the reason why, I was also focusing on not just the social, but the social in relation to capital. I would like to argue here in this paper that the pandemic has made the flows of capital as well as labor much more complicated, but it has left the structural underpinnings of global capitalism intact. There you will find that there will actually not be any structural change. And the reason, therefore, is also, as we see, as a new kind of enkindling of populist nationalist feelings that have affected welfare policies on something like labor movements and labor welfare. But the virus itself brings to the fore the ontology of social connections and disconnections of human existence. What the COVID-19 has done, that it has evacuated social interactions from the public domain and shifted it entirely to the private. So it therefore helps us rethink our notions of what we mean by individuations, of distancing, of social beings together, about sacrifices, about mortality, about the pleasures of life in a post-COVID age. That we are actually not just individuals, that we are, I've used the word individuals, not individuals. In the building of our public and collective life becomes all too clear now in pandemic times. And this drama that is unfolding between the pandemic and capitalism is here to see that the spatial spread of the virus is actually challenging capitalism and neoliberal, and particularly its neoliberal form. The pandemic, as we see, is affecting the consumption and supply chains simultaneously. And it has therefore upsetted the global capitalist distinctions between the zones of production and the zones of consumption. The former, that is the zones of consumption, is primarily China, and the latter is Europe and US. So the pandemic's planetary character has compressed space and time, but this is not from the point of view of the advantage of capital. So while the space-time compression, which is the characteristic of late capitalism, the opposite actually has been true of people and labor. And here we find that, when we look at the internal migrations that have happened, and it's all before, it's been discussed earlier as well among the earlier panelists, that we find there is an increasing demand for cheap labor in growing metropolis and cities, which we have to recognize. And however, this demand is met by these poor illegal migrants. Their illegalities or transgressions of stringent migration rules push them always to a shadowy existence. But by bringing the whole economy to a halt, the virus leaves this space-time uncompressed. And therefore, the notional distance between places for capital and places for labor has grown. It is a truism, and this is what we have to recognize, that countries that have managed the corona outbreak in the initial stages well are the ones with a robust industrial and manufacturing capacity, like South Korea, Japan, China, and also Germany. These countries have retained some of the Fordist disciplines and have histories of authoritarian rule. With Fordist disciplines comes hierarchy and rules which govern the interaction between experts and state bureaucracies. These are relatively absent in post-Fordist countries like US, Italy, and England, where we find that they're actually struggling so much in coping with this virus. But even in these countries, populist politics has taken root in response to immigration, and they are not able to manage the damaging effects of the pandemic on their population. Therefore, what we have to understand here is the conjuncture between immigration, multiculturalism, post-Fordist capitalism, and populist response in the times of COVID-19. The capital has to be defended. This is the flag that has been, put forward by some leaders across the world, is now pitted against the specter of more socialist-style welfare measures adopted by Asian countries, particularly Vietnam, which has successfully beaten the virus at home. So the war of positions is laid out very clearly. What COVID-19 enjoins states to do now is to make health facilities available to all, at least the poor, and also to allow for mass production of equipments for running the health economy, which is made into a business of the state. But what is also simultaneously happening along with the formation of the social is the omnipresence of the state, which in a pastoral sense is not actually dictatorial, but one which is paternalistically inclined. It is highly dependable or convenient in extreme crisis, or at least this is what the media is making us believe. The plausible outcome of COVID-19, therefore, forces us to rethink our valorizations which are tied to capital. How the latter, which is capital, wriggles out of this impotency is through the backdoor of power relations and labor discipline. But the problem is that the humanitarian non-logical outcomes is forcing capitalists and the state to abide by safety and health standards for workers. And this is, of course, for populist reasons. So we may come across now a new coming into being of a pandemic subject, which has to recognize the priority of biological life, or some philosophers like Agamben calls bare life, and the non-rational spheres of life and labor above capital. The pandemic actually also behoves us to question ourselves about who we are as a collective, because it is the collective that is responding to the virus, and how we are socially and spatially located, and our subnational identities as a response to the sort of capriciousness of capital. The pandemic actually here has exasperated or increased the vulnerability of labor, and we found it absolutely visible when hordes of migrant workers were walking thousands of kilometers to their native villages, not even knowing whether they would be able to reach their destination as such. This precarity of labor, if at all we have to resolve this problem, has to be seen in relation to the unevenness of spatial development. And this is because how we address the problem, and this is a larger question that we have to address, is that if we are finding migrants returning from cities like Mumbai and Delhi following the lockdown, we have to address the question, why is it that some migrants' labor has to return to a specific area? And why is it that this reversal or this kind of a pattern cannot be reversed in order to, obviate any possible crisis that may emerge in a future pandemic? The COVID pandemic forces our thinking. It forces us to think about our dependencies here, about the hierarchies that we have inherited, the value systems that we have, the value of say, the value of the family in a way. Because in some ways we find that Western democracies and Western societies are finding it difficult to cope is also because of their peculiar understanding about what privatized existence would mean. And this whole question of wearing the mask in public is also a value question for them. It is also about solidarities, and it is also about our ethno-national identifications. And this is the reason for this is ultimately the positive, or what one calls the more prudent response to the COVID crisis has to come from a certain kind of a rule allowing for cooperation between segments of a society. And there will be segments which are disadvantaged. There will be segments which are advantaged. But the cooperation has to be instilled. And this cooperation has to be both vertical as well as horizontal. There has to also be a new kind of engagement with peace-building measures. After all, this cooperation can only take place when we assume that there is some kind of a trust building. And trust building only happens in conditions of peace. At the same time, there has also the need to have a diversion of resources that will allow for regional development. And lastly, there is also the need to promote expert knowledge and the importance of doctors and specialists and social scientists coming together and sharing the knowledge before before state officials or before the bureaucracy, in order to at least in the beginning to take some initial steps to tackle not only this pandemic but even future pandemics as and when it comes. So I think I'll stop here, and we can have perhaps discussions.
Yes, yeah. Thanks, Dr. Basu, for bringing this dimension, right? Particularly from possibly you're a sociologist, I guess, from the sociological point of view, right? So, how the pandemic, right, has, in some sense, kind of deepened the contradictions in the capitalist system, the kind of drama that is unfolding, and the kind of newer kind of hierarchies that are getting created, and the new kind of pandemic culture that is getting created, including, of course, the privatized existence, right, through social distancing and several such mechanisms, right? Yeah, so that was a good insight into as to what is the reality, social reality the pandemic has created. So, and of course, the way forward, not only to overcome this kind of hierarchies and segmentation, and possibly to break those kinds of barriers in the present and also in the future, right? Yeah, so thank you very much, Dr. Basu. Yeah, so the next speaker is supposed to be me and supposed to speak on the topic of conundrum of statistics, as I had agreed to Dr. Hippu. But now, of course, since I took some bit of time at the beginning itself, so probably I will not go into my presentation on conundrum of statistics. And some other occasion possibly I may share, because we need to have some discussion based on of course, the overview that I gave and these three insightful presentations. So therefore now, straight away, I will, given the time constraint, I will straight away get into the discussion part, right? Yeah, so any questions, comments, are welcome, right? Any kind of interventions on this, even if the students, if the scholars have their own, any questions on their own topic in relation to COVID, etc. So the panel will try and address. Yeah, so yeah, people may type out if there are any kind of problems in communication. So please type out your questions and comments on the chat box, so which can be conveyed to the panelists, right? So in the meanwhile, yeah. So I have a question to, of course, to Dr. Sarkar, right? First, right? Right, of course, you brought out the precariousness of the unorganized sector workers, right? Of course, though you were also trying to relate to some of the bills that are being introduced, but can you particularly tell us whether these new bills, because there were also a lot of criticisms from the organized sector also, are they going to do justice to these unorganized sector workers, these new codes, right? So that's the question to Dr. Sarkar.
Regarding incorporation of the interest of the informal sector workers and the precarity of their employment, which was also quite visible in the pre-COVID, in the post-COVID period, there are certain positive incorporations. Like I said, that the definition of migrant workers has changed quite remarkably. Now, even worker can self declare himself or herself as a migrant worker, and also document it in a portal. So that is possible. So the next time these things happen, government will not be having the excuse that we don't have data. So that is there. That is taken care of to a certain extent. But though there are a few problems with that too, but that is taken care of. And also with regards to the unorganized informal sectors, like the definition has been broadened as such under the Social Security Code and also under the Occupational Health Safety Code. The wage code was enacted much earlier last year. So after this pandemic, the three codes that came about, Industrial Relations Code is more about organized sector, and this Social Security and Occupational Health and Safety, regarding these two codes, there are some positive incorporations learning from the COVID experiences, like definition of migrant worker, like in broadening the definition of unorganized sector workers, and their domestic workers, gig workers, platform workers, all these have been included. And the appropriate government, in most cases, labor is in the concurrent list, so state government has very important role to play. And a lot of liberties have been given to the state government to include any section of the workforce as part of the informal sector workers diaspora. So that includes flexibility and the freedom to include any occupation, any segment of the workers. And also the central rule has also incorporated certain section of the workers who were rendered jobless during this COVID period, like domestic workers and IT sector workers like gig and platform workers, those have been specifically mentioned in the code. That is on the positive side. On the negative side is that, but at the same time, there was a hope that this code is going to universalize the social security, but that unfortunately did not happen. It still remains with certain section of the population, workforce, particularly the organized sector workforce, but social security was not extended to the entire informal sector diaspora. So that lacuna remains because this code is going to be there for the next 30, 40 years. So it was an opportunity to rectify a big mistake of not giving social security to the informal sector workers. And it was thought that at least even after these experiences of these bad experiences of COVID-19, that would be included. But unfortunately, that was not done. So social security was not universalized in the code. That is one of the very negative part of it. So
right. Okay. Yes, Dr. Avijit, also can you see whether you have got any questions on the we have got any questions on the chat box, etc. I'm not sure whether they are displayed on my window, right? But I'm trying to look at them. In case you are able to look at them, please relay back the questions to the panelists. Yeah,
Sure,
but,
sir.
yeah. My second question. Yeah.
I'll try to, but I think the host can do it. So
Yeah.
I'll try to connect to the host and I'll let you know, sir.
Okay. Yeah. So meanwhile, I have a question to.
There is nothing in the chat box, so that's
okay. Okay. Then I will be. Meanwhile, yeah. My next question is to Dr. To the second presenter, Dr. Santanu. Yeah, you said that you came up with a finding that about the risk perception. People in general have expressed low chance of being infected. So that kind of a finding you highlighted, right? But I was possibly looking for the reason. Has it got anything to do with the way the government has communicated, the state agencies and public health agencies had communicated to people about COVID itself? Or it is their own kind of experienced kind of a learning that we are not going to be affected, maybe others will face. That is the common kind of a notion, right? All of us think that nothing is going to happen to us, others will face, right? So was there any gap, in my view, was there any gap in terms of the communication from the health agencies that possibly might have led? So therefore, that is also kind of a problem, right? So did the government do right thing in conveying the risk perception? Because of course, if I would have made presentation, so one of the reasons as to why statistics and data and information has to be transparent during pandemics like COVID is about the risk perception also, how people perceive risk, and public agencies have the onus to make data available so that there are no wrong notions. Yeah, so that's what was coming to my mind, right? How would you reflect?
Yeah, no, I think that's a puzzle we were also sort of deliberating on. So I didn't present all the findings. So some of the findings may be able to explain. So what we noticed is that during that time, I mean, during the early phases of the pandemic in April, May, and June also, people were actually following social distancing quite religiously. I mean, I would say particularly in the Delhi NCAER region, I'm not sure about other places, but what we've seen that like more than 50% of the households, household members or the respondent, whoever was the respondent, more than 50% of them did not have any contact with anyone outside the household the day before the survey. And also those who have contact, it's very small, like 1, 2, 3, 4, 5. Only very like 5 to 10% of the respondents, they mentioned about higher number of contacts, like more than 50 contacts or so. So that could be one of the reasons, because they were following sort of social distancing, and also the people taking precautions of sort of wearing masks, etc., were also reasonably high. That could be one of the reasons they don't think that they can be infected, because they are following them properly. And also with time, like in the third round, it was like 3 months in the pandemic already. So in 3 months they were not infected, so they thought probably they will not get infected because only a very small percentage is actually getting infected. So that could be another reason, that's the complacency type of thing. And another is, it's, as you mentioned, it's more of a sort of psychologically, we tend to think that the bad things is there, but it cannot happen to me. So there's a psychological theory also, I forgot what it's called now, but that could also be one of the reasons.
Okay. Yes, yes, yeah. So maybe we are again going to conduct. Possibly you could this thing, but I was guessing whether there was any kind of a bias that came in, because someone is contacted.
Yes, that's also possible.
And
Some
if
kind of,
you say that no, we are having a risk and we will not be able to move, then if any offer of a job or any such assistance, possibly you might withhold.
yeah, there's a chance of that. We not I don't know about in this question, but in some other questions in the context of when we asked them. So that's another question we had. We asked them about how would they agree for an extension of a lockdown, okay, or even the social distancing measures. So the responses seem to be, can be sort of guided by social desirability bias. So whether it's actually they are following or not, or they realize that lockdown is impacting their life and livelihood significantly, still they are supporting the lockdown. That also could be some kind of fear or in social desirability bias. It's possible, yeah.
Okay. Yeah. So what is the possible? Because now even including many of our scholars are also struggling to go to field. So what is the tip or advice you would like to give to these scholars, right? Of course, you highlighted from your study, but now in terms of the current situation, what tip or guidance would you give to scholars who are supposed to now go to field work?
Yeah, so that's, I don't know when the fieldwork can actually start, because the news we are getting that in many villages, they're not allowing the interviewers to go and conduct surveys because of fear. And there's always this concern that these people from urban areas, they are bringing this disease to rural areas. So that concern is there. And MOSPI, the Ministry of Statistics and Program Implementation, they actually started PLFS rounds and another, I think, economic census in some places, but it's a very mixed sort of response they received. In some places, it went reasonably well, but in many other places, it's like 30% response rate they were getting. So yeah, I don't think it's still, we are in a state to resume field work in full fledged.
Okay. Yeah. Okay. Okay. Yeah. Right. Yeah. So yeah. Any Abhijit, any question on the chat box?
Yeah.
Okay. Then yeah. Anybody else wants to ask any question? Otherwise, I have a question to Dr. Sudeep. Yeah.
So after your question, can I also question?
Yeah. Sure. Go ahead. Anyone. Any participant. Go ahead, Abhijit.
Sir, Dr. Sudeep Basu, sir, it was very good listening to you. So I am a big time, I completely oppose using the word social distancing, and rather I favor using the word social spacing. So in this time, when the society is already fragmented into various segments, so do you think that the word social distancing has been deliberately used, and that this word can have a considerable impact on the society? So what is your take on this, sir? Thank you, sir.
Yeah. So Dr. Sudeep, I also have a question. You can possibly answer together, right? So you said, of course, yeah, the capitalism and neoliberalism has been challenged by this pandemic, but still it has left its basic structures intact, right? No major damage in that sense has been done to the structure. Of course, we have to see how that would turn out. But it has at the same time created, you're saying, possibly new cultures, new hierarchies, right? So new cultures and hierarchies. And you were also suggesting new engagement. So does that mean that all these new cultures and new hierarchies will leave the poor and the weaker even more vulnerable, and would make their position relatively worsen, and which will help again, therefore, the capitalism to sustain itself, thrive, and get back to what people are saying getting back to normal, though that normal was abnormal in some sense. Yeah. Anyway, that is the kind of question that has come to my mind in case you want to reflect.
Right. Both the questions are very perceptive, and in some ways I agree to the propositions that have been advanced. Let me just, the two questions are also linked in a way. When I agree, when your misgivings with the word social distancing, this has a lot of value connotation. We know of the kind of inheritance, social inheritance, particularly caste and also race, that can actually affect the kind of socialities that exist in a society. And we have to be very cautious about the usage of the word social distancing in hierarchies. And in a way, if the hierarchy and the hierarchy that we have inherited, and if the use of the word social distancing by actors within the hierarchy could perhaps actually accentuate this hierarchy that we see, or if not accentuate, it can actually also increase, if not real discrimination, but an imagined idea of discrimination. A more neutral word, spacing, I liked. Some have been advocating why not use the word physical distancing, but actually even the word physical is also social, because the physical can only be defined socially. So the word spacing is very, very neutral, and we know in geography how spacing is used. But even the word spacing has to be, thought through what exactly we would mean by social spacing. And in theoretical terms, I agree that it is a neutral word. But when spacing is being enacted, and if there are certain measures that are being followed in order to execute the spacing, then at that juncture, we will have to be very cautious about the social effects that the word spacing, when it's used in public, can have on vulnerable populations. The creation, and this is the question that Professor Shylendra also indicated about new cultures and hierarchies. The idea here, and this is why the invocation of bare life is very significant, and the use of bare life comes to the fore, and comes to the fore particularly when we have to see the way the whole technology of surveillance, along with welfare measures that are being put in place. On the one hand, it may give off the image that those who are vulnerable are becoming worse off, but at the same time, because the state is not appearing as of now to be truly an authoritarian state, but what I may say, an authoritarian benevolent kind of a state, where the state is also trying to, initiate or bring forth certain kind of welfare measures in order to increase demand in the economy. So it's putting the poor in a vulnerable situation, but yet at the same time giving them a hope in the form of whatever, in the form of maybe, putting them as part of a welfare net, or using some kind of a rule that they may follow in order to get certain benefits, and therefore creating a certain kind of a demand.
Okay.
So it is a kind of a dual situation, which in a way again brings to in mind the whole political economy of this problem. Of course, I have not touched on that particularly, but as of now, this is what I could.
Yeah,
Yes.
there are a couple of comments. Yeah, Dr. Hippu, just an advice. So can we take another 5-10 minutes and to wind up? Dr. Hippu?
5 minutes is fine, sir.
Okay,
Yeah.
5 minutes. Yeah. So anyway, there are a couple of comments. One, of course, by Dr. Hippu himself. Physical distancing with social bonding is probably the better word. He seems to be suggesting. Dr. Sunil has asked a question. Maybe any panelist can answer. At national level, can we have coordinated approach to invite solutions from doctors, pharmacists, engineers, scientists, and students from all disciplines, right? Towards solutions. A large number of validation centers, lab units to test such claims. Government schemes to promote and incentivize entrepreneurship around such tested ideas, right? Yeah, so that is one question. So can there be some kind of a solutions worked out collectively by consulting various experts, right? Then the second question is by Mr. Soumya Pal. With infectious diseases are here to stay, telephonic and web-based sample survey present itself as alternative. Should the research focus on theoretical statistical estimation problems with this form of data collection, right? That could be specifically to survey question, right? Yeah, okay. Yeah, anyone wants to address, right? Right? Anybody? But of course, on the survey question, Dr. Santanu can answer. Other points, solutions to be worked out jointly or in consultation with all people, right? Yes.
Yeah. Can I just make a small point about the first question about inviting solutions from across sectoral people? I mean,
Yeah.
you therefore. The importance of expert knowledge, and there I was emphasizing on the need to take expert opinion very seriously in order to resolve health problems and societal problems, which are all together. And I think the importance of not just, categorizing knowledge as useful knowledge, and we have to also understand what is exactly useful knowledge. And therefore, the social response to the crisis requires that we have the good point about having a validation center is important, because the information pandemic also has to be tackled. So in order to
okay,
yeah, in order to sort of
Santanu, can you answer the second question, Dr. Santanu? Yeah, Dr. Santanu, in case you are there, can you answer the second question? Yeah, can this kind of data be used for more theoretical and statistical kind of analysis? Can they lend themselves helpful for theoretical and statistical analysis? Yeah, and I don't know whether Dr. Santanu is there or not, right? Dr. Santanu seems to have left. Okay, that's fine. Yes, yeah, of course, one need to be careful. From my own experience, I would answer this question because it has come, if it is from some scholar, right? Yes, the telephonic surveys, right, particularly under crisis situations, are subject to variety of biases and variety of hassles. So they should be possibly used as some kind of pulse testing that we do, right? So because in the crisis situation, we need to understand also as to what is happening. So these can be some kind of a pulse testing, these kind of surveys. Much more rigorous analysis and study would require more rigorous and more rigorous kind of studies like that, right? So of course, if this crisis is going to extend, there is no solution. There is no solution, as Dr. Santanu was telling, at least in the immediate kind of a period, right? Yeah, but one has to be careful in terms of drawing any kind of a drastic kind of conclusions based on these telephonic kind of surveys. Yeah, that's my take. Yeah, so as Dr. Hippu indicated, so let me try and conclude. Yes, friends, it was indeed kind of a useful and a very insightful discussion on the problem of COVID conundrum. So which I try to characterize as some kind of multi-dimensional crisis. Yes, so therefore the presentations definitely brought out ideas that there is a kind of an economic, apart from the health angle, there is an economic crisis that has unfolded and that is continuing, particularly in the unorganized sector, with severe impact on employment and livelihoods. And also socially, newer kinds of realities are also getting unfolded, right? So which are possibly not desirable with mechanisms like social distancing, etc., right? So therefore, we need to possibly bring in certain new kinds of engagements to reverse these adverse kinds of development, social developments that are happening, right? So therefore, the conundrum is in that sense getting deeper in a multi-dimensional way. So as I said that no last word can be said, but the overall lessons from the panel discussion suggest that yes, we need to be on guard on all fronts: social front, economic front, health fronts, understand things well and respond right, and respond right with proper understand knowledge as knowledge and information, as some of you have shared, including interesting aspect on people not perceiving it as a risky during this period, right? So yeah, so therefore we need a much more informed and well informed kind of a response to this problem, which is a really a complicated one. So that we address this conundrum well for our own sake and also for the future, right? Yeah, so those are possibly some kind of a concluding words I can draw based on the panel discussion. So I thank the panelists for all the all the insights and for the time that they have given us, right? And I'm sure based on my own understanding, it would have possibly helped the scholars also, right, in getting some good understanding of the problem of COVID, right? So with that, now I hand over the session to Dr. Hippu.
Yeah, on behalf of the entire DOCMAD team, I thank Professor Shylendra for chairing this session, and I also thank all the panelists, Dr. Kingshuk Sarkar, Dr. Sudeep Basu, and Dr. Pramanik for their effort. I know it was a short notice, and you are quite busy, but that you could agree to this session, and I think there was a good participation in this panel, and we all benefited from the discussion. Thank you very much.
Okay, thanks to Avijit also. Thanks to Avijit also. Thank you all. See you sometime.